The idea of Life in Control came in somewhere around 2013. At that point of time, we were thinking of doing something new, and I was traveling between US and India, and I had spent 15 years of my working experience in Silicon Valley. And one thing that I had learned during my business schooling days in Stanford was, always look at innovation and look at intersection of computer science and a related industry. At that age of 48, 47, there were many friends of mine who were either having a problem with blood pressure or diabetes. And when we started looking at health and we said, what we can do in that space, these are early years when there was a lot of innovation that was happening specifically in the phone space, and the phone was pretty much becoming like a medical device. We knew that with what was happening in the phone space, that point of care diagnostics will happen, and with that everybody will be roaming around with actually a medical sensor. So Life in Control is actually a platform that helps completely manage diabetes in a very integrated way. Fine, nobody's ever done that before. So we've got a platform for doctors where doctors, when they use the platform, they are helped in decision making. They get proper treatment pathways and care pathways. We've actually taken and put in algorithms in that, which helps decision making for doctors. Fine. So that's one end to it. Then we've got a platform where coaches, diabetic educators and coaches get connected to the doctors seamlessly. Fine. And then we've got an app, consumer app for the patients who are managing their condition. What we've also done now is actually we've also added another community into it, which is the companion, which is either the spouse or the child or the parent of the diabetic. Fine. So we are managing this condition in a very holistic manner. We are shifting from just curing it to caring it. Fine. So it's a platform that manages a person with diabetes on a continuum of care. Fine. So doctor is able to manage this person over years, creating something that we call as a care plan. This care plan gets communicated to a coach. The coach manages the diet, the exercise, looking at the data that the doctor has given him. Fine. So the coach has access to all the clinical data of the doctor, and he actually makes a coaching program very, very personalized to the patient. And this data is also seen by the family, and the family can also nudge the patient and say, you know what, this is what you should have eaten, you have not recorded your medication, or you've not had your medication. The overall vision behind this is to improve compliance. Fine. And if you are able to improve compliance to a person who's got a condition with diabetes, you are able to improve his quality of life later on in life. I think the Indian healthcare industry or the Indian government has to take a lot of active and proactive interest in this space, because if you look at it, if you have more than 13-14% of your population which is diabetic, you are actually going to face a tsunami in the next few years. Fine. The economic burden of managing diabetes is in multi-billions of dollars. The quality of life of people with diabetes degrades a lot. So now what you have to do is you have to look at the prime reasons why all of a sudden this condition is increasing, and it's very clear that this is a lifestyle condition. Fine. So how do you actually go about creating parks for your citizens? Fine. If you look at, we have not gone well and created walking pathways for people to walk. Fine, which is a very important aspect of life. The other aspect is, what do we eat? How do we actually look at diet? And do we subsidize wheat? Do we subsidize rice? Or do we subsidize vegetables? If you make the cost of vegetables so high that people cannot afford it, and then the prime diet that people have is restricted to a very high diet of carbs, and that is the reason you will see that diabetes is well spread across different demographics in India. It's very important that we come and look at diet and lifestyle and exercise and even the ability to just give parks that the citizen in this country can walk and eat something which is more holistic rather than what we are eating right now. I think by taxing, for the further thing is by taxing industries which have high sugar content, we exactly know what is, why people are getting diabetes. So if we actually take this data and we look at why are people getting diabetes, and we create policies around parks, policies are about taxing the sugar industry, and policies around subsidizing what kind of food. I think the health industry and the ministry in India would have taken very proactive measures. Technology is, as I said, an enabler. Fine, if you look at a country with 70 million diabetics, we have one of the lowest population of doctors to manage the 70 million people. Fine. So we have to use technology very interestingly. First of all, how many people have not been even assessed and diagnosed with diabetes? Fine. A simple blood test, let's look at, can actually assess that if a person is diabetic. Technology platforms help doctors because they get a lot of data, and through the data they are able to assess the condition well. They're able to keep this data for years, and with that look at how this data is either deteriorating, a person's condition is improving or deteriorating, and use this data intelligently to improve decision making. Fine. So what we've done is we've actually created, looking at this data, treatment pathways and care pathways that help the doctor in decision making at one end. The ability of every patient to use a phone like WhatsApp or any messaging tool is so simple that it connects the patient and the doctor across cities, across villages. Fine. So a patient could be in a village anywhere where he might not have access to the best medical health care, but he could be connected to a doctor anywhere. He could just message his sugar reading and the doctor could actually look at it and give a prospective prescription or something to, could address it. Similarly, if you look at if you start looking at the ability for mobile to communicate to you, remind to you, fine, message you, fine. So if you use the capability of mobile technology very well, you can become compliant to diet, medication, and your exercise, and you can actually get knowledge why you have to exercise, what you can eat. Fine. This is at a very basic and grassroots level. Now let's go a little further. Now once you start having this data that people are diabetic and this is what you have, then we start coming on to the actual benefits of the data, which is ability to mine this data and get intelligence out of it. We started this company around 2.5 years back. Today we are a team of close to 45 people. The team comprises of people from the healthcare industry, many people with computer science knowledge, and even doctors. Now with this, what we've done is we've reached close to more than 100 doctors. Through these 100 doctors, we are managing more than 1 lakh diabetic population through our platform. We are also working with some of the largest pathology labs, managing diabetic program with them. Right? So in total, we've got more than 1 lakh of diabetic. We've got a population of close to 1 lakh of diabetics. We look at that data in a very scientific manner, and with these 100 doctors, we make sure that their population is very well managed and compliant. The future plans are to increase this number to reach majority of the diabetic, close to around 10,000 doctors look at patients. But where we want to go is create a platform where these doctors can very intelligently look at the patient. We are able to engage this patient and improve compliance. So once we do that, what we will start getting for every patient is a continuous risk score of this patient. And with the compliance, we will be able to modify this risk score. So we'll have at one end a risk score, and at one end we'll have actually a compliance score. We've already started working with certain insurance companies to actually manage the risk related to a diabetic for the insurance companies. So as we look at 3 years or 4 years or 5 years from now, what we would have created actually is a perfect ecosystem where we have doctors using a platform which is based on very standardized way of looking at a chronic condition, and also a very standard way of actually engaging a patient. And with this, and what we have seen even presently that we are doing, because we are doing clinical study of what we have done with some of the leading doctors and leading medical institutes. With Manipal, we are actually doing a clinical study of our program right now, and we've seen results with doctors that have actually improved patient outcomes. Right? So 5 years or 7 years from now, we would work very closely with insurance company and enabling the diabetic to actually get an insurance policy, which sometimes he's refused today. Right? So we want to make the quality of life for the diabetic better and the experience for the doctor managing the diabetic population much, much better.